Hi everyone. Now we are going to learn about ciliary ganglion. Okay. So as soon as we hear about a ganglion, it feels like a very alien structure, but it's one of the most interesting structures. Okay. So ganglion is what? It's basically going to be a collection of cell bodies. Meaning, so if there is going to be one neuron starting from the brain, okay, its cell body is there in the brain, and it's going to have the axon traveling all the way up here to the ganglion, and it's going to relay here. The next set of neurons, they are going to start here and they're going to travel out to the peripheral organ. So this portion is going to be like a meeting point, okay? So where the one axon is ending and the other axon is starting. So like this, there is going to be like millions of neurons, right? So that's why we say ganglion is nothing but a collection of cell bodies, okay? Now, in the head and neck region, we have four important parasympathetic ganglions, in which one is ciliary ganglion. This is related to eyeball, and it's a relay station for fibers supplying sphincter pupillae and ciliaris muscles. Okay, so sphincter pupillae is a muscle for the pupils. Okay, then we have the ciliaris muscles, which is for the ciliary bodies. And here, whenever we study ganglion, we come across these terms. It is topographically related to someone and functionally related to someone. What do you mean by that? Topographically means it's just located with someone. Okay, geographically it's connected to someone, but that nerve is not actually taking part through this ganglion. Okay, so that's topographical relation. Next, functionally means actually this person, that nerve is going to actually relay in this ganglion. So that's functional relation. So topographically, this ciliary ganglion is going to be related to nasociliary nerve, if you recall, from the ophthalmic division of the trigeminal nerve. Okay, so it's related to the, it's hanging, it's attached to the nasociliary nerve, whereas functionally it is related to oculomotor nerve. The actual functioning nerve fibers are traveling through whom? Oculomotor nerve. Okay, so this is the introduction about our ciliary ganglion. So I would like to quickly show you the location of the ciliary ganglion. As you can see here, it's present above the optic nerve, and this is like a little bit proximally drawn. It might be a little bit behind also. So it's located near the apex of the orbit between the optic nerve and abducent, excuse me, between the optic nerve and the abducent nerve. Okay, so this is the optic nerve and this is the abducent nerve, and here we have the lateral rectus muscle. Okay, so in between them it is sandwiched. Next, we have ophthalmic artery is medial to the ganglion. Do you remember the ophthalmic artery is again, it was crossing from the lateral aspect and moving towards the medial aspect, isn't it? So the ophthalmic artery is closely related medially to the ciliary ganglion. So this is where it is located. Next, we are going to have to know about like three components. It's going to have three types of fibers passing through this or relaying to this. Number one, it's going to be parasympathetic root and sympathetic root, and then we have the sensory root. Now you tell me, parasympathetic means relaxation, right? Sympathetic means when you're in a flight mode. Now, in this eyeball, in this cornea, in this pupil, you know, right? Whenever there is like a sympathetic stimulus, what will happen to your pupils? It is going to like constrict. Is it going to become small, or is it going to become dilated? The pupil are going to enlarge, like it's going to dilate. Can you think in sympathetic, if sympathetic system is activated? So I'll give you one scenario. If there is some sort of like a animal attack, okay, so what you will do, like your eyeballs, your pupils, they are going to open up more. Why? Can you think of a reason? So your pupils are going to wide up more, open up more, because that way there can be more number of light fibers coming in, light rays coming in, and you will have a wider field of vision. Okay, so that you will have like a wider view. You will see like, okay, how can I escape? How should I go? Where should I go? How fast should I go? So at that time, what happens is the pupils are going to dilate, and then you're going to have more information about the space and then run. This is regarding the sympathetic system activation. Whenever parasympathetic system is activated, you tell me, when you're relaxed. Okay, now what will happen? The pupils are going to be constricted. You know why? Because you're not alert, you're not going to escape or run away or tackling any stressful situation. At this point you might be, let's say, reading. Okay, you're reading a book. So what happens is, when you have a narrow pupil, the light rays are going to be focused more. Okay, that's going to have a very narrow opening. So the light ray will be focused more, and there will be like a clearer image when you're relaxed. Okay, so if anybody asks you, now you should know very confidently, when sympathetic system is activated, pupils will dilate. When there is parasympathetic activation, the pupils are going to constrict. So now, as I told you, during sympathetic system, if it is going to be dilated, more amount of light rays are going to enter your eyes. At the same time, the vision may not be as sharp as in the parasympathetic system activation. Okay, so this is the actions of this nerve fibers. Now let's see these three fibers. Okay, they're all coming from different parts. Think of them like three different friends. Okay, going in three different buses or in three different routes and going for a destination. Okay, so now let's see about the first friend, which is parasympathetic route. Okay, the parasympathetic route, it is going to start from Edinger-Westphal nucleus. If you remember from my previous lecture, we had two nucleus, for one for oculomotor nerve motor nucleus, other one is the Edinger-Westphal nucleus in the midbrain. Okay, so from there it is starting, and it is traveling through the oculomotor nerve itself. It doesn't have like a separate bus. Okay, so the vehicle it is taking is this oculomotor nerve. ये bus में it is coming, and then which part of that bus? We know oculomotor nerve is going to have a superior division and an inferior division. You remember? So this is taking the inferior division. Okay, so it is going to travel through this branch specifically, that is nerve to inferior oblique, and it is traveling and coming to relay here. There it is going to get down. That friend is like going to get down from the bus. That is the oculomotor nerve. From here, it is going to take another bus. Okay, that another bus, who is that? Ciliary ganglion itself will give rise to certain branches to the eyeball. Okay, so the second bus is the branches from the ciliary ganglion, and they are going to travel till this point. Who is this point? Constrictor pupillae muscle and ciliaris muscle. Constrictor pupillae. Okay, now you should again correlate parasympathetic, constrictor, pupillae. The pupils are going to constrict. Okay, so this is the pathway of the parasympathetic route. This is the first friend. Second friend is our sympathetic nerve, sympathetic route. These guys are always going to start from way below, not from the brain stem, but from the spinal cord level. So here you can see this sympathetic route is starting from this point. This is the cut section of a spinal cord. You can see this is the anterior horn, posterior horn, and the lateral horn of the gray matter of the spinal cord. Now here we have this root coming from the lateral root, lateral horn of the spinal cord at the level of T1. This is like very, very important. So it's starting at the level of T1, coming up, traveling up, and it is going to relay in the superior cervical ganglion. So you must study, you might be studying about three ganglions which is present in relation to the cervical vertebrae. Okay, so out of that we have one superior cervical ganglion. There it is taking the relay. Then, so it has got down in the bus, that is the T1 spinal nerve. So from here again it is going to take another bus. Okay, and it is going to travel around the internal carotid artery, and then it is going to travel without any relay in the ciliary ganglion. Okay, because it has already got down, it has already relayed in the superior cervical ganglion. So it's going to pass through this ciliary ganglion without any relay and ultimately reach the destination. Who is this destination here? That is the dilator pupillae. We know this is sympathetic route, should be causing the dilatation of the pupil. So it's ultimately going for the dilator pupillae. Okay, so if you note here, like In here you see the sympathetic fibers are like always going around the, whenever you study any sympathetic route, you will see, excuse me, it will go around the vessels. Why is that happening? Because these sympathetic nerve fibers are going to be in very much contact with the vessels, so that they will know if there is going to be more pressure, if the heartbeat is like faster, if the cardiac output is faster, if the vessels are dilating. They take information from all that signals. Okay, so that's why they always travel in close relationship. And second thing you should notice is this point, है ना, this segment of the nerve till the ciliary ganglion, that is called as preganglionic fibers, meaning before the ganglion, preganglionic fibers, and this portion will be called as the postganglionic fibers. If you see in the parasympathetic system, the preganglionic fibers are longer, okay, and the postganglionic fibers are shorter. They come close to the organ and then take a relay and then go for the organ. Whereas in a sympathetic innervation, you will always see they relay very early on, like very close to the exit. So that first route, that is the preganglionic fibers, will be shorter and the postganglionic is going to be longer. So now we have the second friend also who have reached the destination. Okay, so now who is the third friend? Third friend is the person who is just like going back. This is going to be the sensory route, which is going to carry the sensations from this region. So this sensory fibers, they are going to travel again through the different branches of the ciliary ganglion, and again without any relay, it is going to travel through this person. Who is this? Trigeminal nerve had like three divisions, right? Ophthalmic, maxillary, mandibular. So if you remember, trigeminal nerve is a mixed nerve, but from the face it is going to carry sensory information, isn't it? So this ophthalmic division of the trigeminal nerve had one branch called as nasociliary nerve, if you remember. And you see these fibers are traveling through the ciliary ganglion, through the nasociliary nerve, through the ophthalmic division of the trigeminal nerve, and then there within the trigeminal ganglion itself, they are having a cell body, and then they are going for the final relay station in the trigeminal nucleus in this pons region. Now, in the midbrain, in the brain stem region, can you see this ganglion? If you remember from general anatomy, like you have this pseudo unipolar type of ganglions, meaning it has a single cell body, pseudo unipolar. It will have like a small axon which will divide into actually two axons. Pseudo unipolar, it appears to be single axon, but it's going to soon divide into two. It's actually should be bipolar. Okay, so that type of ganglion is going to be present here, that type of axon is going to be present here, and this person who is going towards the brain towards the brainstem is called as the central process, and this axon which is going towards the organ, that is called as the peripheral process. That's what we name for any pseudo unipolar ganglion. All right, now we know the sensations are carried from here through the ciliary ganglion, through the ophthalmic division of trigeminal nerve, through the trigeminal nerve. Okay, so now you tell me, if there is going to be any injury related to the oculomotor nerve, okay, what will be the impact? The impact is going to be parasympathetic nerves might be damaged. So during the relaxation time also, there won't be constriction of the pupil. Okay, so by default it might be a dilated pupil. Okay, so that's the first one of the first things. Second, now let's see, there is going to be an injury in the superior cervical ganglion. Now what will happen to these fibers? It's a sympathetic route. So sympathetic nerves, if they are affected, even during a sympathetic stimulation, the pupils may not react, they may not dilate. Okay, so this is the about different sensations. And if this ophthalmic division of trigeminal nerve or nasociliary nerve is affected, what will happen? It may not be carrying the sensations from this region. So that what will happen, even if there is going to be a touch or if there is going to be any foreign body, the patient may not be able to like sense that. So because of that, there can be repeated infections and so and so. So that might lead to keratitis, etc. Okay, so this is the interesting three friends who are taking three different routes and reaching their destinations. So next, so yeah, so from the anterior border of the ciliary ganglion, there are going to be like 8 to 10 short ciliary branches. They pierce the sclera around the attachment of the optic nerve, and then they travel within the eyeball between the sclera and the choroid, that is the outermost layer and the middle layer, and they contain fibers from all the roots. They are the final, that's the final bus which is carrying towards the destination. Now you tell me, a lesion damages the ciliary ganglion, which function will most likely be lost? Is it going to be lacrimation, corneal sensation, pupillary constriction, abduction of eye, or the elevation of the eyelid? Yeah, ciliary ganglion, pupillary constriction might be affected. In fact, there can be some loss of corneal sensation also. Okay. Next, so total paralysis causes ptosis. Ptosis means drooping of the upper eyelids, and lateral squint, dilatation of the pupil, and loss of accommodation, diplopia, and proptosis. So all these symptoms might be there. It is associated with Weber syndrome, which we'll study in neuroanatomy, and there can be supranuclear paralysis causing loss of conjugate movements. I think let's skip this neuroanatomy part for now. We'll come back to that later. Okay. So yeah, thank you so much, and I hope you understood ciliary ganglion, and I hope you enjoy studying ciliary ganglion and other ganglions the same way hereafter. Thank you so much. Have a good one.